We could discuss more health-related issues here, and we're talking about ear infections. Up next, now, an ear infection occurs when a bacterial or viral infection affects the middle ear. It can be painful because of inflammation and fluid buildup in the middle ear. Now, joining us now is Dr. Shayela Makemba to extend on these infections just a bit more. Good morning, Doctor, and many thanks for joining us this morning.
Good morning. Thank you for once again having me on the program, and good morning to our viewers at home.
Yeah. As I mentioned, an ear infection occurs when a bacterial or viral infection reaches the middle ear. Just take us through that process. How does such an infection get to the middle ear?
All right. Before perhaps I dwell into the nitty-gritties, let me just give some terminology in terms of definition so that we can sort of build our discussion on that. Ear infection, by definition, basically, are looking at, there are two types of ear infection that we call an otitis externa, which means the outer ear, and then otitis media, which is the inner ear. Now, the ear is split by a tympanic membrane. There's an auditory canal where your sound wave travels through to the tympanic membrane, that is the outer part of the ear. That can get infected, then that constitutes otitis externa. Okay. Anything, of course, further past the tympanic membrane down into the inner part of the ear, that's called otitis media. Now, simply put, now how the infection get to the ear? Let's start with otitis externa. What basically then happens with otitis externa is that, for instance, in children are prone to pushing all kinds of things into the orifices. A small seed, a pebble, a stone, they sort of push it into their ear, get blocked there. They're afraid of being reprimanded by their parents, they don't say anything. That little thing stays there for a very long time. It predisposes them to getting infection. As adults, for instance, most of the time we use earbuds. We sort of push the earbuds into our ear, we bruise the side of the ear. That can predispose us to getting infection. And of course, with otitis media, which is middle ear infection, what then tend to happen is that most of the time, especially around this winter season, people get common colds. They get what we call tonsillitis, or adenoid get inflamed. The bugs that gives you throat infections, such as streptococcus and Haemophilus influenza. Because remember, your ear, nose, and throat, they are connected. So if there's an infection in your throat, it then travels up into your middle ear and then causes further infection. In a nutshell, that's basically how you get infection. And of course, with otitis externa as well, if for instance you go swimming and you swim in contaminated water, the water gets into your ear, it's moist, it can predispose you to getting infection. Even just simply bathing at home, if the shampoo get in there or the soap get in there and it's moist and it's not dried up properly, all that predisposes you to ear infection.
But more often than not, people struggle to sort of self-diagnose themselves. In terms of knowing that you may have an ear infection, how can they go about that?
All right. Basically, let's look at the presentation basically as to how an individual presents when they picked up an ear infection. Starting with otitis externa, which is the outer part of the ear, what then can happen is that if you develop an infection, you can get a discharge. It can be watery or purulent. Purulent meaning there's pus. You can have redness and swelling. The ear feels blocked and sometimes you don't hear properly, or further described as sometimes hearing loss. Depending also if you have a bit of a fungal infection, you can have some cheesy things discharging from your ear. All that can now sort of point you to a possibility of an otitis externa. And of course, by far, because most of the infection are accompanied with fever, you get a fever. And sometimes just touching the pinna of your ear, sort of develop that tenderness and uneasy feeling. And oftentimes you also tend to get headaches. What then tend to happen also, you can have what we call an ear pain, especially when you are chewing. That is now with otitis externa. Now moving further down to the inner ear, which is now otitis media, what can tend to happen is quite common in children. The children, they tend to be irritable, crying all the time. They don't want to feed properly. They tend to get fever. The sleeping pattern is disturbed, and you sort of find the children fiddling with their ears, that can also point to the fact that there's probably a possibility of a middle ear infection going on, And of course, most of the children now, when they get especially recurrent otitis media, what tend to happen is that they can suffer permanent, hearing loss. And then of course, how that then present out is because remember, children, they learn to speak by listening. Now, if the hearing is damaged by an infection, you find that these kids are struggling to speak. They got what we call speech impairment.
Yep.
You know, you enroll them into a creche, they are not seemingly, you know, attentive like other children, and they are not able to perform like other children. And then, you know, the daycare teacher will now tell you your child doesn't seem to be hearing when I'm talking to them. All this could point to a possibility of an ear infection.
Which type of infection is most common, the otitis externa or the otitis media?
I will say basically by far, especially in the pediatric population, which is children, otitis media, which is a middle ear infection, tend to be common. All right, and to an extent, you do get it also in children. With the otitis externa can also happen in children, but you know, the most common one by far is the otitis media.
And which would you say is more dangerous, so to say?
The otitis media can be very dangerous in a sense that if not promptly treated, remember, all these structures are connected. So it then spreads further. It can then lead to infection to the brain. You develop meningitis.
Yep.
You develop what we call mastoiditis, which is infection basically, you know, into this bone at the back of your ear. And then, of course, what can happen is you can develop neck abscess, brain abscess, either extradural or subdural. So otitis media tend to be more dangerous because the complications are life-threatening.
Dr. Makemba, let's discuss the treatment of these ear infections.
All right, basically how you approach treatment is that, okay, let's start with otitis externa. Now, somebody comes into your office, into your practice, into a clinic, and then you have now ascertained they have otitis externa. You know, so the idea is you give them something to kill the fever. We call it antipyretic, like paracetamol. Once you have done that, then you give them some ear drops, acetic acid ear drops. And then, of course, you know, you see the cotton wools. You know, you can sort of, you know, just, you know, roll it and form a whisk if there's especially a discharge. Then you just sort of, you know, ask them to dry mop, what we call dry mopping their ear. Normally that tend to take care of an otitis externa. You know, you do that, you follow them up in 3 to 5 days, you find that it has resolved. Failure to which then you can institute antibiotics. And then, of course, further going down, if the antibiotic doesn't seem to be, you know, of course, yielding better result, then you do what we call ear syringing, where you clean the ear out properly. That is now otitis externa. Now, otitis media, on the other hand, the approach is almost similar, but then what you do is you give them something to sort of bring down the fever, and then you immediately introduce antibiotics. And then again, in 3 to 5 days, you follow them up. Oftentimes, they tend to do very well. Now, failure to which, if they don't improve, sometimes then we get what we call a persistent otitis media with an effusion. That will then call for you to send them to a specialist, what we call an ear, nose, and throat specialist. They can then put in what we call a grommet into the ear, which is just a small plastic. They sort of pop the tympanic membrane, put it in there, to sort of just, you know, release that effusion. And then, of course, with time, most of the time it actually falls out on its own. It's very few times that the child has to go back and have it removed.
Let's discuss home remedies. I can recall my mom using castor oil, lukewarm. Just in terms of some home remedies, what are some of the common home remedies?
All right, basically when you're looking at home remedies, let's just start off with the basic few things. Of course, good hand hygiene. Just that proper supervision, you know, just taking an inventory, especially into, you know, the surrounding of your child, seeing what the child is up to, make sure the child is not pushing things into the orifices. And then, of course, as parents, when your child starts growing up, of course, then you enroll them into a creche. And you find that most of the children, they suffer infection at that time. So the idea is to make sure that when you are enrolling your child into a daycare, make sure that that daycare is properly registered, especially also with the municipality, because remember, municipality have a department of health. Now, when somebody set up a daycare, the municipalities send out their health inspectors to just make sure that everything is up to par. Now, sometimes parents don't really do background check. They just go enrolling their children in any daycare, and, you know, the supervision might not be good enough. Cross-infection between the kids, and then your child is just coming home with infection all the time. Of course, unnecessary use of antibiotics is discouraged, especially ear drops that contain antibiotics. You know, you don't have to use it all the time, because if you use it all the time, you then tend to destroy your what you call commensals. Remember, there are some bacteria that sort of lives with us without giving us problem. Now, you put in a lot of, you know, antibiotic-based ear drops in your ear. Sometimes you destroy the good bacteria, predisposing yourself to getting fungal infection. And then, of course, you know, just, you know, dry mopping your ear properly. There is no place for earbuds at all in the ears. You know, I think Of course, the folks that produce earbuds don't always want us to say this, but
yeah.
you know, clinically and medically, we know that your ear physiologically has the ability to clean itself. So when you put in earbuds into your ear, you are basically just interfering with the natural process
of the ear,
you know, waxing and then, you know, cleaning itself, and then predisposing yourself more to more infection. So at home, stay out of earbuds especially, and of course, make sure that your ear is dry at all times. Then, of course, the throat infection, make sure if you pick up a throat infection, get it treated promptly. And then, of course, just generally, if you're not having a throat infection, the idea is to always, you know, go to the pharmacy, get that vitamin C, take a vitamin C, especially the winter season, boost up your immune system, strengthen it so that it can naturally fight off the infection by itself.
So earbuds are no.
No.
So earbuds, I need to go home and throw away all my earbuds.
Yeah, just go home and throw away all your earbuds, basically.
All right. So in terms of, you know, the likeliness of a person getting an ear infection throughout their lifetime, just, you know, how likely is one to get an ear infection throughout their lifespan?
Basically, like I've said, of course, it's common in children. Most of the people that you talk to, their history of having ear infections probably, you know, predominate their, you know, early growing up days. You know, normally they get a lot of infection there. And then, of course, you look at immunocompromised individuals, people with diabetes, people with HIV also tend to get a lot of infection. By far, it's a quite common ailment that we see. Maybe in the population, over 75% might as well have had ear infection at some stage in their life. Complications, not so common anymore. Used to be then, but of course, as the medical fraternity is advancing, things are getting better.
One of the technical personnel with this production is asking, you know, what about an ear buzz, like the sound of buzzing at night? Apparently he gets that often. What could that be an indication of?
Yeah, a buzzing sound in the ear doesn't always mean ear infection, all right? Individuals that are hypertensive, especially when the blood pressure is not properly controlled, that can also sometimes, you know, give them these buzzing sounds, and then of course produces dizziness, you know. The idea is then to just, you know, have it properly checked out and have them had a proper ear examination done.
Doctor, just as a final thought, and, you know, as we head further into winter, just please revisit these precautions we should take, particularly during the season.
All right, especially during this season where common colds and throat infections are common, which then tend to predispose you to ear infection. The idea is basically to, you know, go to the pharmacy, like I've said, get yourself some vitamin C, boost up your immune system, all right? If you pick up a cold, don't sit on it. You know, if it persists, you know, make sure you promptly see the doctor, you treat it properly. And of course, you know, just, you know, take a good care of yourself, and, you know, make sure you're warm, you know, during this time of the season, and you should be fine with that.
Doctor, always a pleasure having your insight here on the program. Many thanks for joining us this morning.
Thank you very much for having me on the program.